Coronavirus. WHO was alert to several cases of pneumonia in Wuhan, China, Hubei province of China. The virus did not match any other known virus. By the time January 7, 2020, Chinese authorities confirmed they had been identified as a new virus. The new virus is a coronavirus, which is a family of viruses that include the common cold and viruses such as SARS and MERS. The new virus was temporarily named as 2019-nCoV, first generation. Coronaviruses are zoonotic, meaning they are transmitted between animals and people. Several known coronaviruses are circulating in animals that had yet infect humans. This new strain of coronavirus has been officially referred to as novel coronavirus. WHO has been working with Chinese authorities and global experts from the day they were informed to learn more about the virus, how it affects the people who are sick with it, and how they can be treated, and what countries can do to respond to it. Common human coronavirus usually cause mild to moderate upper respiratory tract illness, like the common cold. Most people get infected with this virus at some point in their life. This virus illness usually only lasts for a short amount of time. Symptoms may include running nose, headache, cough, sore throat, fever, general feelings of unwell-being. Human coronavirus can sometimes cause lower respiratory tract illness, such as pneumonia and bronchitis. This is more common in people with pulmonary disease, people with weakened immune system, infant and older adult. 2019 coronavirus, like MERS and SARS, all of which have their origin in bats. Chinese authorities have successfully sequenced the genome of the virus, allowing for effective detection. Early on, many of the patients in the outbreak of respiratory illness caused by 2019 coronavirus in Wuhan, China, had some link to a large seafood and live animals market, also known as the wet markets, suggests that initial spread of the virus was animal to person. Subsequently, it has become clear that human-to-human contact is able to spread the virus. The complete clinical picture of regard of this virus is still not fully clear. Report illness have ranged from infected people with little to no symptom to people being severely ill and dying. How does the novel coronavirus spread from person to person? Human coronavirus most commonly spread from an infected person to other through 1. The air by coughing and sneezing. 2. Close personal contact such as touching and shaking hands. 3. Touching on object or surface with the virus on it. Then touching your mouth, nose or eyes before washing your hands. And 4. Rarely, through contamination. When person-to-person spread has occurred with MERS and SARS, it is true to be happen mainly via respiratory droplet produced when an infected person cough or sneeze, similar to how influenza and other respiratory pathogens spread. Spread of SARS and MERS between people has generally occurred between close contact. It's important to note how easily a virus spread person to person can be varied. Some viruses are highly contagious. Others viruses can be less. If you develop a fever and symptom of respiratory illness, such as cough or shortness of breath within 14 days after travel from China, you should call ahead to healthcare profession and mention your recent travel or close contact. If you have had close contact with someone showing this symptom who has recently traveled from this area, you should call ahead to a healthcare professional and mention your close contact to and their recent travel. Fever may not be present in some patients, such as those who are very young, elderly, immune suppressed, or taking certain fever-lowering medication. Clinical judgment should be used to guide testing of patients in such situations. Close contact defined as being within approximately 6 feet or 2 meters, or between the room or care area of a novel coronavirus case of any prolonged period of time while not wearing recommended personal protective equipment. Close contact can include caring for, living with, visiting, or sharing a healthcare waiting area or room with a novel coronavirus case. Having direct contact with infected scenario of a novel corona case, example, being coughed on, while not wearing recommended personal protective equipment is very dangerous. Infection among people are always of public health concern. The risk from this outbreak depends on characteristics of the virus, include whether and how well it spread between people, the severity of resulting illness and the medication or other measures available to control the impact of the virus, for example vaccines or treatment medication. The World Health Organization (WHO) coordinates global response. In this case, established in 1948, is the directing and coordinating authority of international health within the United Nations system. As of February 10, 2020, 43,112 cases has been confirmed globally, with 42,648 of these cases confirmed in mainland China. WHO has now categorized China as very high risk, while outbreak is classified as being a high risk at regional and global level. A total of 1,018 people, based on February 11, 2020 figure, so far have died following infection with the novel coronavirus, with the last death outside China reporting in the Philippines. It has also been reported 4,127 people have so far recovered from this coronavirus. Thousands of patients has been infected with the virus across China, with central Hubei province being the worst affected. Restrictions on travel are affecting at least 20 million people across 10 cities, including the capital of Wuhan. The Chinese government has also closed a large number of temples, the Forbidden City, and part of the Great Wall. We can pray that doctors and nurses have the strength and endurance to attend the sick and dying. We can ask God to give them the courage to be the first line of defense as their selflessness put their life on the line. We can pray for those members of the many countries and denominations of all religion who along their children choose not to evacuate so they might attend to the spiritual as well as physical needs of their communities. Government agencies in China around the world are able to work together to contain the epidemic. We pray that scientists, biomedical engineers, and epidemiologists worldwide who are racing to find to a certain contain the virus, cure the sick. We ask whoever who can help to create a vaccine that can put in production and distribute to save lives. And finally, for individuals we see potential of goodness of the world, who make a difference through acts of kindness and compassion that emulate the spirit in times of darkness.